statement was finalized at the end of this 3-day meeting, and in this joint statement it was concluded as one of the recommendations that IGNOU certificate program in healthcare waste management should be utilized for all the countries across the globe for capacity building. And we have other stakeholders, who are interested in it, like GEF, the Global Environment Fund, has shown keen interest as capacity building in some other countries in which GEF is active, and this may come through. And then this joint statement, when I came after Geneva, from Geneva, this joint statement was, it was expected that all the member countries and stakeholders will, their organizations will endorse and will be the joint signatory to this joint statement of Geneva WHO. And I'm very happy to tell you that IGNOU Vice Chancellor very kindly endorsed it, and we have responded back, and we are one of the signatory as IGNOU to this joint statement which was adopted in the Geneva conference. Friends, there is another very landmark development which I would like to share with you, and that is very recent, as recent as a day before yesterday. We, WHO CRO again was in touch with WHO country office in Bangladesh, and the Bangladesh, following that workshop, has been working to have a IGNOU study center in Bangladesh. I was invited by WHO country office Bangladesh, and I was there for last 3-4 days. I came back in fact yesterday only, and I'm very happy to tell you that IGNOU has signed an MOU with Holy Family Medical College Hospital in Dhaka, and WHO Bangladesh has given 30 fellowships for 30 doctors of the government hospitals from district hospitals all along Bangladesh to be the students for the first batch which will be enrolled now, and they will be able to take exams in next June. So this is a very hearty welcome. We have opened an international center in Dhaka, and the IGNOU will now sign this MOU and send it back to them. The process has started. We are also with the active support of Mr. Alex, probably should be able to open centers in some other countries. In fact, Bhutan, Sri Lanka are likely to be the next countries, including Maldives. Nepal already, the international division of IGNOU is in touch with a partner institution in Nepal, and we have got already 4 applications from Nepal, and maybe, Ruchika, that this center also comes through very soon. So Megha, probably you were also not aware of these good developments, and so these are the things we are constantly, because you see the biomedical waste management has assumed serious dimensions in terms of health hazards and patient safety and injection safety. It is now increasingly the state, the countries, the governments, the health experts, the WHO are seized with this problem that this has been ignored. Many countries in the developing world do not have any formal system, they do not have any rules, regulations, legislation, and the whole issue is so vexed that it is posing serious health hazards to the patients, to the care providers, and to the community at large. And then the damage to the environment, the environmental degradation, deterioration because of various hazardous waste, which Megha will talk to you, and in due course when you read your material you will also come to know about this. So this is a serious thing, and well, India, as you all know, has come out already with the healthcare waste management and handling rules 1998 being implemented from 2002 seriously, and it is mandatory. But even then, you see, our health administrators, planners, medical professionals in particular, with due apologies, have not given this serious attention. And I think time has come that now, at least in our country, which is one of the leaders as far as the biomedical waste management rules, one of the first country in which the rules were promulgated in the Southeast Asia region, should take a lead. And when I visited, I in fact visited number of hospitals in Bangladesh, and the private hospitals, which are corporate hospitals, they are doing fairly well. They have engaged they have outsourced the waste collection. They are doing segregation, and then it is collected every day by the common treatment facility people, private people. And but when we went to the government hospitals, oh my God, it was appalling. It was indeed a very horrendous situation, and the government is seized with the problem. They admit the problem. That's one great thing, because in Dhaka we had an informal workshop day before yesterday, in which there were representatives from the partner institution, the Holy Family Medical College. We had representatives from NIPSAM. You know, NIPSAM probably is National Institute of Preventive and Social Medicine, and we had representation from the government of Bangladesh, Ministry of Health, that is the DGHS, and we had the representation from Dhaka Medical College. We had the representation of the Dhaka Municipal Corporation Health Officer came. So we had very good group, and this group, when we presented the IGNU program, they said that this is so much needed, and it's good that it has come to our country, and we look forward to benefit from this program. The country stands to benefit from this program. So this, I think, was just to give a hilltop view of the developments so far that have taken place. Ruchika.
Thank you so much, Dr. Agarwal. I think you have summed up very nicely all the developments right from the inception of the program which have taken place. All the important milestones have been mentioned, and I think they are very important for you to understand how the program evolved and what is its present status once you take up this program. Before now, I would just like to request the regional directors to inform us how many students are there in the regional centers, since I think the message I had sent to all the regional directors and the program in charges. So I do not know how many students were able to actually come for these sessions, because this is very important. I would also like to give one or two more announcements. The second teleconferencing will be held on 7th of September. And the time is from 11 a.m. to 1:45 p.m. We will be having 3 sessions. So you can please kindly note that is 7th of August, 7th September from 11 a.m. to 1:45. I would also request our studio people to kindly scroll the telephone numbers and the fax numbers. If in case you have any queries during the session, related to the session or related to the program as such, you can ask us just now by dialing in and talking to us, and you can also fax in your questions. Now, another important development is that you have to fill in you will be appearing for the examination, term and examination in the month of December. You need to fill up a form which will be available from 1st September till 30th September, and this form will be available at your regional centers. Since you are there in the regional centers today, you can contact the regional directors and ask them when the forms will be available and how you will be able to take them, because this time the form is different. We have a form which is given behind your program guide. Till now, that form used to be filled by getting photocopied and submitting for examination, but now the policy of IGNO is that payment has to be made ₹50 per course when you have to appear for the examination. So the form has been changed slightly, and the new form can be available from the regional center. It will also be probably put on the website. You can download it from the website after 1st of September. So this is in general about the announcements. Now just I'll give you an overview of the program. Now this is a certificate program. Certificate program means that it is a 6 months duration program. Now it was the program was developed, as Dr. Agarwal has already mentioned, in collaboration with WHO CRO, and it is basically a major step towards solving the problems of healthcare waste in Southeast Asian and other countries. And it also has been developed to provide education to the different healthcare professionals and others in healthcare waste management. Now can we focus on the objectives, please? The objectives of these programs. The objectives are basically, can we have the slide please? To sensitize the learners about healthcare waste and its impact on our health and environment. It is also required to acquaint the learners about the existing legislation, knowledge and practices regarding healthcare waste management practices in Southeast Asian countries. Now not only the practices in India have been discussed in the modules which have been provided to you, but also the healthcare waste management practices in the other Southeast Asian countries. And the third objective is to equip the learners, that is to equip you with the skills to manage the healthcare waste effectively and safely. Now you are already aware that the duration of this program is 6 months. That is a minimum duration, that is after 6 months you are eligible to appear for the terminal examination, but in case of certain academic or personal problems you are not able to appear, then there is a maximum duration of 2 years in which you can complete the program. After every 6 months, that is in the month of June and in the month of December, the terminal examinations are held and you can fill up the forms and then appear for the examination. So consequently we have got this session starting from January to June and another cycle of the session from July to December. So all of you have enrolled for the July to December session. Now the program package, you already may be aware, since you must have already received the material, consists of the self-instructional material, the program guide, the project guide. The academic counselor's guide is not part of the package which is offered to you, but is a guide which is given to the academic counselors or the trainers who help you with the context spells and the project. Then we have the videos, and we also have a 6 days contact period that is carried out at identified program study centers. All of you must be aware about which is your program study center. In case you are not aware, you can ask your regional directors today. We have 2 courses in this program basically and 1 project. The project is a separate course, and the first course is basically general, which basically, as you can see, is on environment, and the healthcare waste management strategies is the second course. So the first is basically about the environment, and the second focuses more specifically on healthcare waste. As I have already mentioned, we have a 6 days context spell. This is a rough model of how the 6 days context spell is carried out, though these are the activities which are to be carried out day-wise, but you may see that in your specific program study centers, these activity may vary from one program study center to another program study center, depending upon the availability of the counselor and the availability of other things like the video, the VCR and all that. So this is how it is done. Then of course we have a teleconferencing and we have a radio conferencing. We have a teleconferencing which we are doing just now. It's a 2-way interactive session, and we would expect you to ring up and call back and ask all your queries. Then only it becomes a 2-way interactive session, otherwise it just remains a 1-way dialogue. And I would like to inform you here that we put all the dates of the teleconferencing, the exam and all other important information on the website. The website of IGNOU, as you can see from your program guide, is ignou.ac.in. We have a School of Health Sciences in that, and in that what's new, we put the dates of the teleconferencing in that website. So you can see that website, and you can also see the email addresses over there. You can contact us on email in future if you have any queries. And as far as the evaluation system is concerned, we have 2 types of evaluation. One is the term and theory evaluation. There will be 2 papers, one for the course 1 and the other for the course 2, and then we will be having a project evaluation. The project have to be completed, and only after the submission and evaluation of the project can you get a certificate that you have completed this program. and the project has to be undertaken in consultation with the academic counselors, and you have to submit the project report to your program in charges. Please take care that you submit your project report to the program in charges, who will be distributing it among the counselors for evaluation, and then the marks will be sent to the headquarters for inclusion in your grade card. Then this is just to give you an overview which is already present in your program guide. The distribution of the marks. In the first paper we have maximum marks as 50, and we have kept 40 as the pass percentage. That is percentage, not 40 out of 50, please. That is 40%. That means you should have a minimum of 25 marks. Sorry, 20 marks. 20 marks. And the second paper is again of 75 marks. So again the pass percentage for all the 3 courses is 40%. And you have to clear all the 3 papers separately. Please keep that in mind. The addition of all the marks of the 3 do not have to be more than 40%. Individually you have to clear them with a minimum of 40%. Now this is just to give you an idea of how the project will be evaluated. The project will be evaluated on the following 3 parameters, that is the selection of the topic. So it is important that you select the topic in consultation with the academic counselors, because it is not only how important the topic is towards the program objectives, but also the feasibility, whether you will be able to carry it out and in the stipulated time, because it is a 4-credit project. 1 credit is equivalent to 30 hours, so that means it's a 120 hours project, which does not include just the time of investigation but also includes the time of review of literature and writing the project report. So the complete process should not take more than 120 hours. Keeping that in mind, you have to select your topic in consultation with the academic counselors, then your style of writing or presentation, and the research methodology that you have adopted. We have a separate project guide which you may have seen, and kindly go through that project guide before you decide to get into your project. So I think that's all we have to say about the sir, would you like to add something else as far as the program is concerned?
I think you have covered it very well. The students should now get in touch with their program in charges and coordinators in their respective centers, and in fact they should also request the program in charges to fix up the date for the 6-day contact program, and so that you are aware and you should not miss the 6-day contact program, because during this 6-day contact program the program in charge and the academic counselor will be able to, besides many other things, will be able to help you in selecting the topic for your project, so that you can write the project and submit it before you appear in the examination, because unless you submit the project and it is cleared, your grade card will not be updated. You may appear in the examination, isn't it, Dr. Ruchika?
Yes, sir, that's true.
They can appear in the examination, but the grade card will not be issued. You will not get the certificate. So it is better that you simultaneously complete the project work and submit it and get it evaluated, so that your academic counselors can send those grades to the university for reflection in the grade card. So and then you have to read, because this material which you have got with you, the blocks for the 2 courses, including the waste handlers manual, which is part of the course 2, they are extremely well written. They are a storehouse of knowledge, and I would recommend that at least 3 days a week you must devote 2-3 hours every day for reading this, if not every day. So more you read about it, more will be you'll be more well versed with it. You will have some queries, so that you go to the contact program. After reading the material, you can ask your academic counselors any clarification. During this teleconferencing, we have one on 7th. You can ask the questions and clarifications if you have read it. So that is what I would recommend. Yes.
Thank you, sir. I would also like to add that we have got the videos of these program, which are available in the program study center. In addition, these videos are also available for sale. So in case you would like to buy the videos, you can buy them from IGNOU. And it's important to visit the website often because like we have a lot of information, like we also have the previous question papers, sample papers in the IGNOU website under for students. You can access the website, access these question papers through the website. I think we can take the session now. The session for discussion in the first session will be on healthcare waste. So let us begin by discussing what is healthcare waste. So healthcare waste is actually any waste that is generated during the diagnosis, treatment and immunization of human beings or animals in research activities pertaining thereto, or in the production or testing of a biological. So as you can see that it's a very wide range, and anything which has to do with the diagnosis, treatment or management or immunization, prevention, it all comes under the healthcare waste. Now there are a lot of sources of the healthcare waste. The sources could be from the hospitals, the nursing homes, clinics, health center, outreach center, diagnostic center, blood bank, mortuary, dental clinics, animal houses and so on. We also have a miscellaneous source, and that is, for example, the home, the house also. When you throw away the old tablets, the bottles, the cottons, for example, you've got hurt, bandages. So all this also comes under a minor category of miscellaneous waste. Now waste has been categorized into various categories by WHO and various other organizations also, but we would be consider the WHO classification of waste. Now in this, the waste category is divided into the following categories. The first and foremost is the infectious waste category. Now what is infectious waste? Infectious waste is the waste which is suspected to contain certain pathogens. Pathogens are disease causing organisms. So the waste which has these disease causing organisms, which is basically obtained from laboratory culture, that is microbiological or pathological labs, then from isolation wards, tissue materials and equipment that has been in contact with the infected patients or excreta. For example, a bedpan or anything. So all that is basically infectious waste. Then we have pathological waste, that is human tissue or fluids, for example body parts, blood and other body fluids or fetus. The third category is very important, and that is the sharps. Sharp waste basically includes all waste like needles, knives, glass, blades, etc. Then of course the pharmaceutical waste, that is expired drugs or medicines which are thrown. Then genotoxic waste. That is basically the waste which has got cytotoxic drugs, those which are used in the cancer treatment, malignancies and other chemicals. And then we have chemical waste, that is for example in the laboratory reagents that are used for testing various, various tests, and the film developers. Then we have certain waste which have high content of heavy metals. For example, the batteries, broken thermometers is a very important component, because mercury waste, mercury cannot be destroyed, and mercury basically just enters into the environment and it remains there, so that itself, and is very toxic, so it is very important. And of course BP instruments. Then we have pressurized containers, for example gas cylinders and aerosol cans, and radioactive waste. Radioactive waste basically includes the unused liquid from radiotherapy units, packaging of radioactive materials and excreta of patients tested with unsealed radionuclides. Sometimes we give radioactive dyes and all to patients, so that is also included in this waste. Now this is as per the Indian regulation. As you can see that it is the categories are little different, though all the wastes are also covered. All the wastes are covered in this, but they have been categorized in a different way. This is, for example, the first category is human anatomical waste, that is the human organs, and this has been categorized on the basis of how we are going to treat or dispose the waste. So this is basically incineration or deep burial waste. Then category 2 is the animal waste, in which we have animal tissues, organs, body parts and so on. Again this has to be treated by incineration or deep burial. Then we have the microbiology and the biotechnological waste, and this is basically from the laboratories and the vaccines, and this is treated by local autoclaving, microwaving and incineration. Then we have the sharp waste. that you have already explained. Basically they are treated by disinfection. Disinfection is done through chemicals, and then autoclaving, microwaving, and mutilation and shredding is done. Then we have the discarded medicines or cytotoxic, that is cancer drug waste, and this is by incineration or destruction and drugs disposal in landfills. Then of course we have the soil waste, that is the items which have been contaminated with blood and body fluids and linen, the beddings and all. So this is done by incineration, autoclaving or microwaving. And then we have the solid waste. The solid waste is the waste which is generated from disposable items other than the shafts. For example, the tubes, the catheters, the intravenous sets and all, and this is also disinfected by various methods like the chemical treatment or autoclaving or microwaving. Then we have the other types of waste like the liquid waste, that is disinfected by the chemical treatment, the incineration ash which is disposed in the municipal landfill, and then we have the chemical waste that consists of the insecticides, the disinfectants and all, and that is also discharged into the drains for liquid and secured landfill for solids. Now this is something which I would like to explain to you, that why is the healthcare waste so important. Now this, if we take 100% as the total waste that is generated by any healthcare facility, then 85% of the waste that is generated is non-infectious. For example, the paper, the non-infectious boxes, carton boxes, so many things could be there which are medicine boxes are disposed. But it is 15% of the waste that is infectious. And what happens is that if we do not segregate or separate the waste and treat this infectious waste, then the whole waste becomes infectious, which is a large volume of waste to be treated if we do not segregate. So segregation is the key to the active process of scientific waste management and is defined as separation of different types of waste as per management and disposable options. So it is very important to segregate the waste before we manage it. Would you like to say something, sir, about this as far as segregation? How many hospitals that you have gone across and seen whether segregation is there? And I think even Megha, I would ask her to supplement.
I think yes, Megha has been also going around and knows. Megha, maybe you also share something, yes.
The segregation, as Dr. Bhupa has said, is the key to any waste management procedure. So in the hospitals or outside, if we don't segregate the waste, then the entire 100% of the waste goes as infectious waste outside the hospital. So as far as segregation, it has to start right from the point of generation, where a nurse or a doctor, whoever is giving an injection, he needs to or doing any procedure, he needs to take care that the sharps are put in separately and the covers and the wrappers are sent separately. If we're mixing everything together, everything just gets infectious. So segregation starts right from the point of generation, where it's the doctors and the nurses who's responsible, and then we put it into different waste streams, which Dr. Kuba will just cover in, where different colored waste streams are there. And then it's again a point to be noted that once the waste is segregated here, it should not be mixed again at the point of transportation or final disposal. Otherwise the effort that's been put in earlier will get and go waste. So it's basically this that we have to look in. And as far as segregation, I've seen some couple of Indian hospitals who have taken a keen step for waste management, and some of them are located in Delhi, some outside Delhi, and I would say all the study centers especially that we have identified throughout the country have been doing extremely well in terms of waste management. And they've taken these steps where not only segregation is a key to their whole system, but they have well-defined systems like appropriate number of bins, the staff is being trained. So I think all these are important aspects. And now in India there must be at least we have at least more than 100 centralized facilities which are there in India. So I'm sure all the hospitals with the rules coming in are really taking care of it. But the education still has to be there.
Yeah. I think, thank you, Dr. Megha. And I think another important aspect that I would like to cover, because most of the material is there in the modules, but sharps management I think is a very important concept. Now the things that one has to take care of, sharps management, as I have already said, sharps are the needles, the glassware which are used. So this is always destroy your own sharps yourself, because passing on the sharp to the others can always cause injury. Never pass used sharps from one person to another. Never recap the used needles. Locate the needle destroyers and containers near the point of generation, because when you are taking the used sharp to a longer distance, then there are more chances of injury. And disinfection of the used sharp in the PPC. Now this is a photograph of a needle and syringe destroyer, which is now quite common, and I think most of you must have seen a needle and syringe destroyer in which the needle is inserted and it is destroyed.
The electronic one.
Yeah, it is. And this is an electronic one. Now these are the colored bins which Dr. Megha was talking about. We have got basically 5 colored bins, and that is the yellow bin, which is basically secured landfill disposal for the human anatomical waste, basically the pathological, the microbiological waste, cytotoxic waste, discarded medicines and all are put in this. Then we have the red bin. The red bin is basically for non-incineration treatment, and this includes the infected plastics, the syringes, the tubings, the catheters and so on, which cannot be incinerated. Then we have the white bin. The white bin basically requires no treatment, and it is basically non-infectious waste, so it consists of the paper, packing material and all. So we need to segregate this so that this waste doesn't become infectious with the rest of the waste. Then we have got the green bin. Again, it requires no treatment, and it includes the biodegradable waste, basically the vegetables, the fruit peels, the leftover food and so on. And then we have got the blue bin, in which we have all the sharps, and this has to be separated because we have to put them in the puncture proof containers so that they cannot injure somebody. Now these are again 2 diagrams in which how the transportation can be done, that is the movement of waste from the point of generation to the final disposal. We have an internal transport. This is an example in the first one, and the second one it shows how external transport, that is in the big vans, it is being taken. Now final treatment and disposal, as you have already seen even when we have done the classification, basically includes incineration, autoclaving, microwaving, chemical disinfection, secured landfill and centralized biomedical waste treatment facility. So this is basically in nutshell how the healthcare waste can be managed. The details of the various procedures are given in your modules. You can kindly go through them in case you have any doubts about them, and you also may be involved in the healthcare waste management wherever you are working. In case you feel certain discrepancies or you feel certain doubts, you are free to ask us today in the second session. Now we are already nearing the completion of the first session.
You can also ask them to get back to us, because we have not heard any response from anywhere.
Yes.
So we would like, at least in the second session, wherever our students and regional directors are there, to please
we would like to know at least how many students
Yes.
have been there, because whether they have been
That's
able
right.
to come for the first teleconferencing session or not.
Yes. We'll
Thank
break for 15 minutes.
Yes, we'll break for 15 minutes and then join back. Thank you.